Hi everyone, my name is Jeff, a senior physiotherapist and also the founder of Remarkable Physiotherapy and Rehabilitation. In this video, I would like to share with you on the ways to improve your respiratory immunity and fight against COVID-19 and other respiratory infections. Now that we aren't able to move around freely outdoors due to the COVID-19 outbreak, some of us had resorted to performing home workouts to maintain our body fitness. Contrarily, some of us had also begun to develop a sedentary lifestyle. But let's not forget that this different lifestyle still require one of the most basic functions of the human body, breathing. There is actually a proper way of breathing, but provide us more benefits other than just simply breathing in and out to keep yourself alive. All of us born breathing with the proper technique. However, as we grow and mature, our breathing pattern begin to change and adapt according to our habits. Why is proper breathing technique so important? Firstly, it boosts your digestive system. Secondly, it helps to increase your lung capacity, improving your sleep quality, and more. Before I jump into the ways to improve your lung function, let me share a little bit on how poor lung function develops. Firstly, lack of activities and staying sedentary for a period of time. Look comfortable, but what you can't see with your naked eyes that are already happening in your body are the loss in muscle mass, reduce in tissue extensibility, and even bone strength that you have developed throughout your whole life. Altogether, this is what we usually call a rapid deterioration in musculoskeletal fitness. When they are required to perform a certain task, they then realize that it actually requires a higher effort just to perform a simple daily task. As they begin to feel lethargic, this requires them to exert more effort to breathe in and out, leading to an obvious symptom, which is shortness of breath. Therefore, it is important for us to maintain an active lifestyle by performing at least 150 minutes of moderate aerobic exercises or 75-minute vigorous aerobic activities in a week. Another few factors that will lead to a poor lung function are aging, constantly smoking, and inhaling pollutants. And not to forget, repetitive respiratory infections such as pneumonia and as those seen in post-COVID-19 patients. This results in the lung losing its function to expand and recoil effectively. Due to the reduction of tissue extensibility, those affected will commonly acquire the habits to gasp for air with their upper chest muscle. In the long run, you will begin to develop postural issues such as rounded shoulder, which greatly reduce your lung capacity. Alright, after this long talk, do you realize about yourself or anyone around you having developed habits and symptoms that I have mentioned above? Don't panic, as I'm going to share with you another way on how to self-manage with some easy exercises in another video. Link in the description box below. On another note, if you know of someone require assistance from our expertise, do not hesitate to inquire our services through phone, Facebook, or Instagram. At the same time, continue to stay at home and take care of your personal hygiene throughout this pandemic. Do not forget to like, share, subscribe, turn on notification to receive any updates from our channel. Once again, I'm Jeff from Remarkable Physiotherapy and Rehabilitation, and I will see you again next time.